Heat-related illnesses. Part 20, Heat-related illnesses. Welcome to the lesson on heat-related illnesses. In this video, we will discuss the signs and symptoms of heat-related illnesses such as heat cramps, heat exhaustion, heat strokes and sunburns. Heat-related illnesses can occur due to extremes of temperature, particularly in elderly and during vigorous exercise. Heat cramps results in painful muscle spasms of the extremities, the back, and the stomach. Sweating and headache may accompany the cramps. Resolving heat cramps. Symptoms of heat cramps usually resolve with resting, cooling off, and drinking water or a sports drink. Light stretching and massage can also be helpful. Heat exhaustion is more serious than heat cramps. Signs of heat exhaustion consist of dizziness, vomiting, muscle cramps, fatigue, increased sweating, lightheadedness. How to care for someone heat exhaustion. Step 1. Move them to a cooler environment. Step 2. Have them lie down. Step 3. Loosen or remove clothing as much as possible. Step 4. Spray them with cool water, and fan them if possible. Step 5. Have them drink water and remain with them until advanced help arrives. Heat strokes are life-threatening and require immediate action. Signs and symptoms of heat stroke consist of confusion, loss of consciousness, dizziness, muscle cramps, vomiting, seizures. Note: if you think someone is having a heat stroke, immediately call 999/EMS. How to care for someone with heat stroke. Step 1. Assess scene safety, wear personal protective equipment, and get the first aid kit and AED. Step 2. Use a spray bottle filled with cold water and a fan to cool them. Step 3. Have them drink water or a sports drink if they can. Step 4. Continue to cool them until their behavior returns to normal or until advanced help arrives. This concludes our lesson on heat-related illnesses. Next we will review sunburns.